Thanks for staying with us. So over 13,000 COVID-19 cases have been recorded in the latest 24-hour cycle that has pushed the positivity rate to over 23%. The Health Department has also reported 149 new deaths, taking the toll to 58,590. So active cases countrywide have risen to over 110,000. Gauteng accounted for 62% of the new cases. The 8,403 new infections reported in Gauteng is the highest daily number recorded in the province since the start of the pandemic. The test positivity rate in Gauteng is at around 25%. On vaccination, more than 479,000 people have received the single-dose Johnson & Johnson vaccine and are fully vaccinated. The remaining 1.6 million have received the first dose of the two-jab Pfizer vaccine. The number of administered Johnson & Johnson vaccines is expected to increase in the coming days as teachers, admin workers and cleaners at schools are given their single-dose vaccine. More than 580,000 school staff are expected to be vaccinated in the next 2 weeks. Let's bring in our senior researcher at the Council for Scientific and Industrial Research, the CSIR, Dr Ridhwaan Suliman. Doc, great to have you again. As usual on a Sunday, let's unpack those numbers. So, Dr Suliman, average daily cases up by 48%, the test positivity rate at 20.2%. Certainly that's a red flag.
Yes, Griselda, indeed, these numbers are really of concern. We continue to see that rise in the daily number of reported cases, as well as that test positivity rate nationally. It is still being spurred on by a concerning surge in the populous province of Gauteng. So yesterday we reported over 13,000 new cases at a test positivity rate above 23%, the highest recorded since January this year. If we look at the 7-day average, the number we've reported just over 10,100 new cases per day on average over the last week nationally, and that figure has increased 48% week on week. As you can see from the color of the bar, of the last bar in this graph, we've now breached the 20% test positivity level. The average over the last week just over 20% now, confirming the increase in infections that we are seeing, but also of concern is that now for less than every 5 tests conducted, one is returning a positive result. So certainly many more undetected cases.
And I mean, how does this compare to the second and to the first and second waves?
Yeah, so the case incidence currently is at 17 new cases per 100,000 people per day. This is nationally. It's up to just over 50% of the second wave's peak and up to 80% of the first wave's peak. The rate of increase is still concerning, doubling about every 12 days. And that rate of increase is similar to what we were seeing during the second wave. So really tracking the second wave's trajectory right now, and much faster rate of increase than what we were seeing at a similar time in the first wave.
Major concern here in Gauteng. We continue to visit several hospitals, Dr Suliman, and there was an indication over the past couple of weeks that both public and private facilities, would be having significant problems, and over 3,000 new hospital admissions this last week. That equally of concern, the rising numbers in Gauteng as well, remaining the epicenter?
Yes, indeed. Gauteng is the biggest concern right now. It is the most populous province. It accounts for 25% of the total population in the country, but currently is recording almost 2/3 of the total number of cases that we are recording nationally. And we continue to see a rise in the number of cases in Gauteng, yesterday being another new daily record high of over 8,400 new cases. This current 7-day average in Gauteng is just over 6,400 cases per day, and that case incidence is now 21% higher than the previous peaks, and still rising. The cases have increased by over 55% compared to a week ago, or doubling about every 11 to 12 days. And as we continue to see this rise in the number of cases, unfortunately, we'll still continue to see that burden on hospitals. As you mentioned, hospitals in Gauteng are already overwhelmed, and that will unfortunately continue as we still see this increase in cases.
Apart from the fact that, Gauteng is the economic hub, you've got a lot of movement in Johannesburg, Johannesburg being the epicenter within this particular province. What are the contributing factors to this, Doc? Is it a lack of change in behavior, or was this expected, given that, or did we expect the third wave to be as brutal as we're seeing it carry out at this particular stage?
There are probably a few factors at play at the moment. I think certainly we were expecting a really harsher third wave in Gauteng over the winter months. And that's because Gauteng was probably spared during the second wave in relation to the three other big provinces. Remember that Gauteng's second wave peak was similar to its first wave's peak, whereas the other three provinces had a much severe second wave. So lower immunity levels in the population in Gauteng, so more people possibly being susceptible to exposure and infection this time around. I think also behavior, mobility patterns, and an increase in gatherings since sort of the Easter period have all triggered what we are seeing right now. So all of that is probably all factoring into what we are seeing currently in Gauteng.
Give us a breakdown of the picture per province.
So besides Gauteng, we continue to see an increase in the number of infections across all of the provinces. Maybe most notably to start off with is that the case incidence in Western Cape and Mpumalanga have now breached the 30% threshold of their previous wave's peaks. So even though in reality they were in their third waves, they now both also officially entered into their third waves, together with the four other provinces that have been indicated for the previous 2 weeks: Northern Cape, Free State, Gauteng, and Northwest. The rise in the other three big provinces is of concern. Western Cape's new cases have increased by about 50% week on week. And then Mpumalanga's increased by about 31% week on week. Eastern Cape, KwaZulu-Natal and Limpopo, while still at very low case loading levels relatively, the new cases are increasing quite sharply still in all of these provinces. Eastern Cape's up 72% week on week, KwaZulu-Natal up 46%, and Limpopo up 61% week on week. Northern Cape and Free State seem to have surpassed their peaks. However, they remain at a high case loading, or have plateaued at a very high case loading, showing a similar number of cases at the moment compared to a previous week.
Just over 20% the test positivity rate nationally. Let's break that down per province. What are the indications there?
So of concern, all of the provinces' test positivity rates are now above 5%. So they're all of concern and are increasing. Generally, the test positivity rates, the trend confirms the trend in infections that we have been seeing. Gauteng has the highest test positivity rate at around 25% now. That's 1 in every 4 tests returning a positive result. Northern Cape, Free State and Northwest are around 20%. That's 1 in 5 tests returning a positive result. Western Cape, Mpumalanga, Limpopo, all above 10%, and Eastern Cape and KwaZulu-Natal above 5%.
So what we do know, of course, we've already indicated, public and private hospitals are buckling under pressure. New admissions, that's up 25% nationally.
Yes, so new admissions over the last week nationally were just over 5,700, up 25% week on week. And there remains that strong link. As we see an increase in cases, we then see an increase in the number of hospital admissions about 2 to 3 weeks after. I think of most concern to point out is the pressure in the hospitals in Gauteng. New admissions in Gauteng were just over 3,000 last week, up 36% compared to the week before. Of concern is the number of patients currently in hospitals around Gauteng due to COVID-19. There are over 5,100 patients in hospitals in Gauteng, and of those, over 1,100 are currently in intensive care unit facilities.
If we look at the average daily COVID-19 deaths per week in South Africa, that's up 14%. Are we seeing a drastic increase there?
It's not drastic at the moment. We've reported just about 130 new deaths per day over the last week. And that figure is up 14% week on week. I think we still have to bear in mind that there is a longer lag between cases and ultimately what we see in deaths. We probably have to wait for about 3 to 4 weeks to see if there's any effect. Hopefully there is some higher levels of immunity within the population that would possibly result in lower severe illness and death. But we still have to wait and see. I think of concern what we are currently seeing is a significant rise in the number of reported deaths in Gauteng. It's accounting for more than half of the total number of deaths reported nationally. So in Gauteng, we've reported 62 new deaths per day on average over the last week, and that figure has increased 80% week on week.
80% week on week. In fact, that's what we were going to talk about next, about the deaths coming out of Gauteng. Why is it so, Doc? Perhaps you'd be able to explain a bit better to us. With this increase in deaths in Gauteng, would that correlate on the basis that it is the epicenter and you're seeing much more higher, hospital admissions in this particular province?
Indeed, Griselda. I think that the trend really is following the trend that we have been seeing in cases and the trend that we're seeing in hospital admissions. There's certainly a much larger number of hospital admissions of late. Unfortunately, a proportion of those succumb to the virus, and we are seeing the death numbers increasing, not quite at the high levels that we saw at the peaks of the first and second wave, but bear in mind that there is that lag factor and it will continue to increase. How many people ultimately succumb to the virus is difficult to say. We just have to wait and see. But hospitals in Gauteng are already at levels that we were seeing at the peak of the second wave or approaching that level. So unfortunately, we may continue to see a rise in deaths reported in the province.
We appreciate you always making time for us every Sunday evening. Thank you very much to break down those numbers. CSIR Senior Researcher Dr Ridhwaan Suliman, a pleasure always having you on the programme about this time. So today is, of course, Father's Day. The Minister of Social Development, Lindiwe Zulu, says the department needs to create an integrated approach for families